Hey, everybody. Thanks for joining the ICHRA exclusive podcast. I often say welcome back, but we actually know we have people listening for the first time all the time. So thank you for being here. Thank you for being a learner with us. We very, very much believe in zero cost to consumer education in this health insurance space, specifically around the individual coverage, health reimbursement arrangement, ICHRA, and everything connected to it. And whether you're a carrier, whether you're a broker or your employer, and even an employee just wondering what in the world did my employer just offer me? Hey, thanks for joining us. My name is John. I will be your host today. I'm over on the team at Remodel Health, and make sure to like and subscribe, share if you end up liking this content. We can't do this without your help, and so we want to keep doing it to the best of our knowledge. If you ever have a topic that you want to learn about, email us at hello@remodelhealth.com and we'll get it scheduled. That's the whole point of this entire podcast. So today I've got a really special guest. I say that all the time, but I really am excited about having Kyle from Take Command here, an absolute expert and rock star in the space. And Kyle, welcome to the show today. Thank you so much for joining us.
Howdy. Thanks, John. You might want to replace rock star with insurance nerd, but otherwise I'll take the accolade. Thank you.
Yeah, what you don't know, Kyle, is that in this space on this podcast, the health insurance nerds are the rock stars. We have built our world around this. So, Kyle, thank you so much. I'm so grateful for your energy and your expertise all around this space. Tell us a little bit about what you do over there as the Senior Vice President of Take Command, and what gets you out of bed in the morning.
Yeah, well, John, excited to be here. Thanks for having me on the show. As you said, I'm the Senior Vice President, part of the leadership team here at Take Command, also Take Command Health, depending on what you want to call it. Sometimes we'll just say TC. Been here for over 4 years, building the business kind of as a right hand to our CEO. Started out with a focus on business development and sales, eventually took on a bunch of service teams. Newsflash, I'm not the best at customer service, but I do love the nerdy stuff. So my role's evolved. We've brought in other leaders to really wear those hats for the business. And now I get to focus on kind of this interesting intersection of strategy, policy, and partnerships, and really thinking about how do we move this whole industry forward and get more people interested in and adopting this new model of coverage.
Yeah, the interest that people have has continued to grow, but then with that interest, people are wondering, now what? And then even when they see their potential next steps, they want to really learn about it because this is emerging and it feels still brand new, even though it's been around for a minute. And so as perhaps this is people's first podcast on the ICHRA exclusive or even understanding what ICHRA is, in our prep call, you said that there's a question that you like to be asked. I'm about to ask it for you, but I'm going to set it up. So, qualified small employer HRAs, ICHRA, those have been around since 2017, but then all of the sudden, in 2020, a new solution called ICHRA, Individual Coverage Health Reimbursement Arrangements. And so here's the question that you said you love answering. Kyle, explain ICHRA to me like I'm a 5-year-old.
Yeah, and fair warning to any listeners, if you ever apply for a job at one of our respective organizations, you may get asked this question. So come up with your own metaphor or response. How about this? Since we got some sophisticated listeners, I won't give you the 5-year-old answer or explanation, but I'll give you maybe more to the novice who's newer to benefits.
There you go.
What I like to do with this question is, okay, so let's explain ICHRA in a basic concept. Well, let's pretend like it's our first job in HR and we're going through that week of onboarding. We're so excited for our new career in HR. And the reason you get into HR is because you love people and you want to see people excel and contribute in a workplace and have careers and make money and use it to raise families and whatnot. Well, somewhere along the way, right, when you're onboarding to your new HR career, you get told, and here's how we handle the benefits for our company, and then, they're explaining all this stuff and you're going, whoa, this is way over my head. And you innocently raise your hand and say, I have a question. Why is it that I, in HR, am responsible for shopping for the health benefits or the health insurance for all these employees? I don't know what's in their best interest. why can't we just earmark some money and give it to the employees and let them shop for coverage? And honestly, for years, you might have gotten laughed out of the room as a new HR professional because they would have said, we can't do that. Well, now you can. And it's really because of two key things. One, the important consumer protections that were put in place by the Affordable Care Act, 10 plus years ago, where now no matter if you're sick, healthy, or otherwise, those employees can get good coverage. And two, thanks to this funky acronym ICHRA, I can now set aside pre-tax money and give my employees a monthly allowance to let them choose the coverage that's best for them. That's how I like to explain it.
Yeah, I love that so much. And there are a lot of people that really do love the nuance. And I'm probably one of those people. I'm a spreadsheet guy. I've read every page of the Affordable Care Act and the ICHRA and all this. So I like this. But the fact is, especially at the employee level, at the family level, mama taking her kiddo to the pediatrician level, it's really important to simplify things. Now, talk to us about that concept of making something complex, simple, and accessible. Why is that so crucial in this topic of ICHRA?
Yeah. Well, I guess, let's reflect a little bit. So we're sitting here in June of 2024, recording this podcast, and it feels like ICHRA is having a bit of a moment, if you will, right? Like a lot more people are waking up to this. As you mentioned, it first came available in 2020. Now, granted, we were in the midst of the biggest pandemic we've seen in our lifetimes. So I think a lot of people were distracted by other things and maybe not so focused on what's the latest, greatest new way to do health insurance. So maybe the couple of years it's taken to get to this moment of awakening, the pandemic affected it. But I would argue also that what's affected this is a lack of awareness, because ICHRA is a very simple concept. This idea of, can I earmark money, give my employees a monthly allowance, and let them shop? It's a simple concept hiding behind a convoluted acronym, right? Individual coverage, health reimbursement arrangement. I think most people, as soon as you start to explain the acronym in that way, you lose the audience. And I say this as a guy who's gotten to do a lot of education in recent years. I've had to learn to retrain myself when I'm doing, educational sessions for HR professionals or brokers. It's like, start with the simple stories so that then you can ease them into the kind of more complex stuff around what you can and can't do with these types of programs.
I love that. And oftentimes complexity just makes people afraid. And we're already afraid of health insurance because it matters so much. We're already afraid of the change to health insurance because we've seen the negative impact of not having good insurance. And so certainly when you're just explaining a new delivery strategy of health benefits, just keeping it simple is really helpful for most of the stakeholders. But thankfully, I just want to make sure those of you who are listening or joining for the first time, or maybe joining again, this is not just going to only be a simple episode. We're just trying to give a little bit of something for everyone. Kyle's got some really incredible data that he's going to be sharing on a couple case studies around the United States. So I'm excited to hear from you on that, Kyle. But let's first start with two big things. Who is ICHRA good for? And then also, who is ICHRA probably not yet a good fit for? But let's land on, identify the right fit, because brokers primarily listen to this podcast. They want to know, in my current book of business, who might be a good fit that can be served really well with ICHRA.
Yeah. Well, I will start maybe with a simple kind of conceptual construct, and then we can kind of break it down more. But what we have seen with ICHRA adoption is there's really two stories. For some companies, it can be a great on-ramp to offering benefits for the first time. So as an employee benefits broker, you might call these virgin groups or new to insurance. And we can spend a minute giving some examples. But the other story I would tell you then is it can be an off-ramp for a lot of small or mid-sized or even kind of larger clients who, for whatever reason, are experiencing some pain points with their current health insurance offering and are looking to change it up and are really attracted to this ICHRA model. And generally speaking, those two stories, the on-ramp to offering benefits for the first time or the off-ramp from a group plan, there's going to be different motivating factors that attract them to the model.
Yeah, I appreciate that. The ICHRA Council's data for 2024 just came out, and it certainly is the large majority of those who are taking part in both QSERA and ICHRA. They aggregate the data together, but most of them are going to be in that first category, the new to coverage groups. I've heard commentary suggesting that ICHRA and QSERA are more accessible than perhaps some of the group plans. But what are some of the pain points particular to that other side of the equation? If you're on a group plan, what are one or two factors that maybe a broker can say, hey, that employer group is struggling with that, or that this might be worth looking into for ICHRA for them?
Yeah, it can be all sorts of things. I'd say number one, what most people focus on with anything related to benefits is cost. So look, the reality is what I've learned with benefits is it's one of these things that most companies feel like if it's not broke, I'm not going to try to fix it. And to be honest, that's probably a good rule in general when it comes to your employee benefits. If your employees are happy, your HR team's happy, your CFO says it fits in the budget, don't try to fix what's not broken. But a lot of times it's, hey, my costs are escalating on this traditional group health insurance plan. It's unpredictable year to year what our renewals might come in at. And I'm tired of that lack of predictability. And then the second thing, just as important for many employers, can be the idea of real employee choice. If you're out in California and you've got some employees that are incredibly loyal to Kaiser Permanente, you might not be able to attract and retain the talent if you don't provide a solution in the health benefit space that's going to give them access to Kaiser. If all you're doing is offering a Blue Cross plan or something like that, that can really have an impact on your ability to attract and retain talent. If you go with something like ICHRA, now those employees can choose the health plan and, importantly, the health access that's best for them and their families.
Yeah, that's great. And you've pointed out a wonderful feature of ICHRA is the autonomy of plan selection, because indeed I have personally experienced Kaiser Permanente as a, kind of an HMO carrier. I've been around other people where they believe that that is the best plan for them, but it wasn't everybody. It was perhaps only 80%, and the other 20% would have much preferred another plan option. And so, do you do something for the 80%, or do you do something for, just the 20? And it does provide that opportunity there. And back to your notes on cost, I have heard it suggested that it changes health benefits away from designing the plan into just simply designing your budget. And it allows CFOs to think of this as more of an expense than a purchase of something you're giving to your people. So I appreciate the identification of who is the right fit. I think equally, if not more importantly, is when is ICHRA not a good fit? What are some of those telltales early on? Because I've seen the interest from people who really hope this is the silver bullet. And the fact is there are no silver bullets in this big topic of health insurance. So what are the ways to identify pretty quickly early on for a broker or an employer to say, hey, you know what you're doing is probably still best. ICHRA might not be a good fit for you yet.
Yeah. I'll start with this. Just as you said, there's no silver bullets when it comes to health benefits. And this is an important point to me. Whenever you see people out there kind of singing from the hilltop about the great new solution, whether it's reference-based pricing or level funded or PEOs or captives, or in my case, ICHRAs, buyer beware. If they're not going to be upfront around the real kind of costs and benefits and trade-offs you need to be weighing, then you're probably not talking to the right advisor. And the first thing I'd say with ICHRA is there's change management involved. It is a case study in change management, particularly if you're in that segment that we just discussed that's moving away from a traditional group health. And so really making sure you understand the motivating factors for the client, or if you're the employer, why you're doing the ICHRA move and what your goals are, and being very clear about what those goals are so that when you go through the change management effort, you're crystal clear on like why I'm putting in this effort. Where we've seen things probably take a wrong turn with some clients is, let's say a broker agent's out there prospecting with an ICHRA and saying, hey, your broker's not going to talk to you about ICHRA. Let me tell you about ICHRA. It's the greatest thing since sliced bread. And then they get the HR team or the business owner to buy in, but maybe that client hasn't done their diligence, asked some of the hard questions. And then we get to implementation and they're not really willing to put in the effort to provide a good change management experience for the employees. And then you can really run into some rough edges at that point. So that's probably the first thing that comes to mind when you ask about who might not be a fit.
Yeah, I appreciate that. It certainly is not an easy thing to do because it is a significant change to the delivery of that health benefit. We've been doing group health plans in the United States for the American workforce for nearly 100 years, and we're very much used to it. And I believe the data suggests around 90% of Americans who are insured still get employer-sponsored coverage through that traditional group health plan. So it feels new and it feels foreign, and if you don't stay attentive to when is the best time to change, that's going to be a big deal. One of my pieces of advice is how much change is already occurring in the organization. Oftentimes adding in too much change can make the employee base pretty tired. And so you could also launch a change on top of another change. So yeah, you got to make sure and think it through, but I appreciate your attentiveness to the change management that is indeed involved. So Kyle, let's paint this picture of an HR professional who has sat down with a broker. They've done their due diligence. ICHRA indeed is a great fit from the get-go. They implement things well, they launch it, and they are now in an ICHRA health benefit instead of a group. They started off, let's say, clean January start, okay, real easy calendar year, and they go through it. And they go through, January, February, March, is all the way then toward the end of the year. But now that broker has this moment where they need to talk about the success that they projected and what was the actual win. Because now that we have broken things apart and there's a lot of other variables, sometimes the actual wins can get lost in the midst of, what could have been a mess of an implementation or something. So first, what do you define as an ICHRA win? And then how do you make sure and reflect that back to the employer as a broker later and saying, hey, your ICHRA really did win for you as an org and all of your employees as well. What's a win and how do you keep track of that?
Yeah, it's a good question. I don't think I've ever been asked this question. That's why it's a good one. I'll start with saying, hold on to your paperwork, hold on to your spreadsheets. When you get to that renewal conversation the next year, or maybe renewal is the wrong term in an ICHRA context. Maybe it's when you just get to that, what are we going to do for benefits next year conversation? You want to revisit where things were the year prior. And most of the time, what we see from a pattern recognition standpoint is if you're moving away from a group plan, they've gotten their renewal and they go, oh my gosh, XYZ health plan wants to increase our rates 30%. Let's go landscape and see what else is out there. So as you're sitting down with them as their benefits advisor 12 months later, you want to make sure you have those numbers from the prior years. So you can say, hey, listen, remember, we moved to this ICHRA. There was some good and some bad moving to the ICHRA, but let's focus on the good for a second. Here's what we're coming in today at total cost. Here's what your employers or your employees are paying for premiums. Here's what you as the employer are paying. Here's total cost all in with fees, inclusive of any vendors we're using, relative to what we would have been paying for that group health plan. I think maybe that's one of the first mistakes we see people make is not sitting down and penciling it out again to remind that CFO or head of benefits or that business owner kind of where they were at and why they made the move.
Yeah, I appreciate that because a broker is deeply vested into maintaining their book of business. And the apprehension that many brokers will have on introducing ICHRA is introducing change, introduces risk, and then you're not exactly sure if at the end of this year, after I introduce this new solution, will they be happy? So defining what they will be happy with at the beginning and then reminding them of why they are happy now is one of the best practices for brokers implementing ICHRA. Yeah, certainly.
And just to build on that concept, sorry to interrupt, just to build on the concept, because what we see sometimes, right, is when it comes to all things benefits, it's the edge cases or, the squeaky wheels that get a lot of attention, whether it's how your 401k is set up and the fees involved, whether it's, the group health plan and a couple of employees that hate it, or it's an ICHRA and maybe a couple of employees, had a rough experience. Those edge cases, they become like cultural currency within an organization. A lot of times it's those edge cases that end up on the CEO's kind of radar sometimes. And so if you're the head of benefits, you might be in a position 6, 9 months later after moving to ICHRA where you're like, oh man, yeah, like the CFO is asking, wait, why did we do this? Can you give me the numbers again so I can lay out the business case that provided the rationale for this move? So you as the advisor will have that business case ready to go.
Yeah, that's great, because the fact is employees will be talking, whether it's good or it's bad. And certainly the employer that's a little nervous maybe about ICHRA originally, and then the broker also is a little nervous. Any sort of negative feedback will only be heightened because of the kind of nervousness of the new. And so I appreciate having the business case, the actual numbers saying, hey, remember where you would have been if we hadn't done this, and remember all the great things that have happened, that indeed health insurance at large is messy everywhere. You can look at group plans for a long time. The group plans aren't the solution. ICHRA is not always the solution, reference-based pricing. So making sure navigating change well, taking care of problems as they happen, and then keeping your wins in front of you is really, really helpful. Let's talk a little bit about the macro factors that are impacting ICHRA at large. You had some really good commentary on our prep call for this, and I'd love to just hear you talk about whether it's carriers or brokers or populations, anything to do with those macro factors that are positively impacting ICHRA.
Yeah, well, John, I think, between our two organizations, we've had the opportunity to see thousands of companies look at and evaluate and then eventually adopt this model. And so I think, luckily we, Remodel and Take Command, we're at a point now where we can actually start to say, what's the data showing us, right? We'll be able to move beyond anecdotes. And one of the things we're clearly seeing in the data is different rates of adoption for this new model in different parts of the country. So the number one factor I'm seeing drive adoption is, where is your business located within the greater United States? And from there, I can kind of start to predict how likely you might have been to even hear about ICHRA yet, let alone consider it, let alone adopt it. And there's a variety of factors when you look under the hood that leads to that. First and foremost is, what does the individual market look like in your local metropolitan area? And John, I believe you're in Indianapolis, right?
That's correct.
Right. So I'll pick on Indianapolis just for a moment. So I think maybe 4 or 5 years ago, there were only 2 carriers left in the ACA market in Indiana, CareSource and Centene or Ambetter. Now, these are carriers that may be new to many people in the employee benefit space. They're traditionally very strong in Medicaid, but they've had rampant success with the Affordable Care Act in the individual markets. However, if you're talking to an employer in Indianapolis 4 or 5 years ago and you go, yeah, check out ICHRA, they go, what can my employees enroll in? You're going to be a little, scared when you don't recognize a logo kind of in the individual market. Fast forward to where we are today in Indiana, and you've got a lot of those brand names that employers recognize back in the individual market in a big way. You've got Anthem, you've got United, you've got Aetna, you got Cigna. And so little things like that, like just having brands that the employer and the benefits professionals recognize, can be important. But then what it also comes down to is cost. How far will my dollar go in the individual market when it comes to purchasing benefits relative to how far will my dollar go in the group market? And that kind of cost comparison can vary by where you are in the country as well.
Yeah, you certainly want to make sure that people understand what all their options are. I'm thrilled to see the carrier adoption and sometimes even re-adoption back into the individual marketplace. Indeed, if you kept track of the original insurance companies that were offering health plans on year one, that the Affordable Care Act and the exchange, the individual marketplace, when it launched, there were certain insurance companies that jumped in, and they indeed jumped out. It was a little messy in those very early days, but many of those insurance companies have come back around and now are offering really great plans that are helping the consumer landscape of what employees, individuals are wanting. And so, you mentioned some geographical areas. I know that, y'all are down there in Texas, we're in Indiana. What are some of the other locations that you feel like are just interesting to watch what's happening with the carrier spaces?
Yeah. Well, one trick I'll give you is ICHRA is such a funny acronym that if you go to trends.google.com and just type in ICHRA, you can see where people are Googling ICHRA across the country. So it's one of my favorite kind of party tricks when I'm talking to carriers. They're asking me where it's taken off. I go, hey, just go to Google and you can see where people are Googling it. But yeah, a couple of states that really stand out. Minnesota was one of the very kind of early states to ramp up. Minnesota, Wisconsin. We're seeing some adoption with Indiana, also thanks to some recent state level legislation. Pennsylvania. And then in particular, when you look at a state, you want to kind of break it down, particularly Western Pennsylvania or the Pittsburgh region, we're seeing some adoption. Those are a couple of states that stand out here in these early innings.
Yeah, that's awesome. I'm excited for the way that interest at an individual level and then an employer level and then at a broker level, it really does seem like we've flipped the script a lot of ways for the decision making and interest with insurance products and then obviously being delivered through ICHRA dollars. Which leads us to a topic that I was very excited about as we decided all these little pieces that we'd be given to our listeners today. Let's talk about the viral marketing within the walls of the employer, and specifically around how many times insurance carriers throughout the last 4 to 5 decades have been marketing to decision makers within an organization, and that now plan designs, marketing efforts are being modified to hit family members inside of a household. So just talk about how employees are talking to each other, how employers can take advantage of this, brokers, and even carriers that are listening to this podcast.
Yeah, this is something I kind of woke up thinking about last week, and you and I were prepping for this, and I probably haven't put as much structured thought into this as I should have, but it really keyed off of, for those that are aware, Oscar Health Insurance. Full disclosure, I worked there years ago before coming over to Bill Taking It. But Oscar Health Insurance recently hosted an investor day. They're a publicly traded company, and they were hosting the Wall Street types and whatnot. And they were talking about how they want to grow over the next couple of years. And ICHRA was a big part of their theme. And I was reflecting on, I wonder why Oscar is so interested in ICHRA. And I went back to my very early days at Oscar and how this is mid 2010s, we're brand new, just in a couple of geos. And we kind of joked, hey, we want to be the first ever viral health insurance plan. The first health insurance plan people actually recommend to one another, which was an audacious goal considering, when you look at the average NPS of a health plan. But fast forward, here we are a decade later, and ICHRA is a real thing where we're seeing it taken off. And I think one thing that carriers need to start being mindful of is the different purchasing dynamics of the individual plans within an ICHRA context versus, call it the exchange writ large. Health plans have for years now seen explosive growth for the last 3 or 4 years in the on-exchange markets. This is the highly subsidized population, generally lower income, going to healthcare.gov or their respective state exchange. And you're kind of selling within a highly commoditized environment in that context. Generally speaking, they might be working with an independent insurance agent or just going right into big government and talking to someone in customer service. Well, fast forward, if you have sure, it's still an ACA individual policy being purchased within an ICHRA, but the context matters. And the context is that Debbie has a cubicle next to Sean, who has a cubicle next to Marissa, who has a cubicle next to Benny, right? And when it comes time for benefits, the first person you're going to ask is the person in the cubicle next to you, or the office, or in the Slack channel. And I think that's something where the more that carriers can understand these dynamics, there's probably a wedge there from a marketing angle and just kind of an influence with these employees. But secondly, really getting to understand too, this is a different consumer. with probably different needs, wants, and preference allocations in terms of their buying criteria relative to the average on exchange shopper.
Yeah, the way we shop for health insurance has been very different from the way we shop for car insurance. Even though we all have different cars and we all have different needs and preferences on coverage, we have a lot of accessibility to not only buy unique buy unique car insurance, but also compare it. And there's a lot of great vendors. Health insurance is in those early days of becoming a consumer product with both the education involved in saying these are the features of what they are, learn more about it, and then also key differentiators from carrier to carrier, little interesting products, whether it's, telehealth or gym memberships or anything like that. I'm very excited for the way I've seen individual plans developing because at the end of the day, when it comes to the very simple approach you explained at the beginning of our episode of an employer giving tax-free dollars to their employees and those employees get to pick what they want, those options being more and more developed around them will only be a good thing for everybody. So I'm really grateful for your
And
commentary there. Yeah.
John, just to build on that point, I mean, this is one of the things that we see is just to be candid, this goes back to the change management theme as well, which is year one, that employee might feel overwhelmed with the responsibility of the choice. And I know a lot of employers are worried about with ICHRA, but what we tend to see is by year 2 or 3 of ICHRA adoption, those employees truly start to feel empowered and like the idea of having choice and control around what's the right benefit plan for me and my family, and how do I optimize that choice year over year. It's a journey to get there, but I actually think we're on a path to true consumerization. And what we've seen is when carriers compete, consumers win.
Yeah, that is wonderful. I absolutely love that. Hey, Kyle, any final thoughts before we wrap up today's episode? And ultimately, if people want to get in touch with you, what's the best way to do that?
Oh, sure. Yeah. So my email's pretty simple. I'm Kyle@takecommandhealth.com. I'm always happy to chat with folks around what we're seeing in the markets. And John, just thank you so much for letting me be a part of this today. I appreciate what you all are doing on the education front. We've got a lot of folks that need to keep learning about this.
Yeah, you're more than welcome, Kyle. And I'm sure we'll have you on again to dive in a little bit deeper about the consumerization of health plans, as well as all of the macro factors and everything in between. So thank you again for your contribution to this community and for all of our listeners who either are faithfully tuning in or for the first time. Thank you. We are doing this for you. And again, please like, share, subscribe, get the content out there so more people can enjoy the learning the same way that you are right now. But until next time, let's keep revolutionizing health benefits together.